Bell's palsy. Bell's palsy is a neuromuscular disorder. It is also known as facial palsy. It is a condition that causes a sudden temporary weakness or paralysis of the facial muscles. The paralysis occurring on one side of the face, resulting from an inflamed seventh cranial nerve, that is the facial nerve, that controls the muscles on one side of the face. In most cases, Bell's palsy is temporary and the symptoms usually go away by 2 to 8 weeks. A few people continue to have some Bell palsy symptoms for life. Before going to detail about the condition, we should know about facial nerve. Facial nerve is the seventh cranial nerve. The nerve typically travels from the pons through the facial canal in the temporal bone and exits the skull at the stylomastoid foramen. The main functions of the facial nerve is to control the muscles of facial expression and taste sensation from the anterior two-thirds of the tongue. Causes of Bell palsy. The exact cause is unknown. Viral or the bacterial infections can cause the swelling or the inflammation of the seventh cranial nerve. Herpes simplex, herpes zoster, Epstein-Barr, cytomegalovirus, mumps, rubella, adenovirus, and influenza B can cause Bell's palsy. Risk factors. Bell's palsy can occur more often in individuals who are pregnant, have diabetes, and who have the family history of Bell's palsy. It affects men and women equally. Pathology of Bell's palsy. The facial nerve controls most of the muscles in the face and parts of the ear. The facial nerve goes through a narrow gap of bone from the brain to the face. Due to the causative factors, the facial nerve is inflamed and pressure is produced on the nerve where it exits the skull. This can result in damage of the protective covering of the nerve. This blocks the transmission of neural signals and leading to weakened or paralyzed facial muscles. Signs and symptoms of Bell's palsy. The signs and symptoms come suddenly and it include pain behind the ear, droopy appearance on one side of the face and facial weakness. Inability to make facial expressions includes inability to open or close the eye, smiling, lacrimation, muscle twitches, etc. Drooling. The facial nerve carries taste sensation from the anterior two-thirds of the tongue, so the people with Bell's palsy may present with loss of taste sensation, difficulty in eating and drinking, sound sensitivity, that causing the normal sound to be perceived as very sound. In Bell's palsy, there is only one nerve involvement, so the people with Bell's palsy may have myriad neurological symptoms. It includes facial tingling, headache, neck pain, balance problems, sense of clumsiness, ipsilateral limb weakness. Bell's phenomenon. It is a medical sign in which the movement of the eyeball is in upward direction when the eyelids are forcefully closed. This is obvious on the affected side due to ineffective closure of the eyelids. Diagnosis of Bell palsy. Diagnosing Bell's palsy is often a process of elimination of other conditions that may be causing facial paralysis. The methods are physical examination. In it, check the patient's head, neck, and ear. Assess the facial muscle to determine whether any other nerves are affected. Electromyography. The electrodes placed in the patient's face measure the electrical activity of the nerves and the electrical activity of the muscles in response to a stimulation. This test helps to find out the extent of nerve damage and its location. Other diagnostic measures are X-ray, CT scan, and MRI scans. This all helps to determine other underlying conditions that causes the symptoms. Treatment for Bell's palsy. The medications used for the treatment of Bell's palsy includes corticosteroids. It have been effective at reducing the inflammation. If prednisone is administered within 72 hours of onset, it can reduce the severity of the disease. Antivirals can be used. It will be beneficial along with steroids. Over-the-counter pain medications can be used to reduce the pain. Bell's palsy affects the blink reflex. If the person is not blinking properly, the eye will be exposed and tears will evaporate. So frequent use of eye drops or the eye ointment is recommended. For serious nerve damage, the person may require further treatments. It includes mime therapy. It is a type of physical therapy. The facial exercises and the facial massage, which helps to strengthen the facial muscles and helps to maintain the muscle tone. Another treatment is Botox injections. These Botox injections on the affected side can relax the muscles. The person can go for plastic surgery. This helps to improve the symmetry of the face. The potential complications of Bell's palsy includes muscle contractures. The contracture develops in the paralyzed muscles, crocodile tear syndrome, in which while the patient is eating, their eyes will shed tears, corneal ulceration and blindness. Due to ineffective blink reflex, the eyelids cannot shut and the protective tear film will be ineffective. This causes corneal drying. The infection in the cornea leads to loss of vision. Another complication is ageusia. It is a chronic loss of taste. Nursing care of clients with Bell's palsy. Eye care. Instruct the client to protect the eyes with glasses or goggles at day. Instruct to use a patch over eye at night and apply eye ointments to keep the eyelids closed. Nutrition. Instruct the client to take a soft diet and chew on the unaffected side of his mouth. Instruct to avoid hot fluids and foods. If there is no feeling in the mouth, so it is easy for the food to build up and cause gum diseases. So proper mouth care including brushing and forcing is essential. Care should be provided to maintain the muscle tone. Teach the patient how to do a facial massage and facial exercises. Tell the client to sit relaxed and gently raise the eyebrows with the help of fingers if needed and pull the eyebrows together. Encourage the patient to take a deep breath and flare the nostrils. Instruct to pull one side of the mouth up and then the other to smile. Tell the patient to avoid exposing the face to cold and importance of keeping the face warm. Provide emotional support to the patient. Encourage the patient to express their feelings. And we have to provide adequate information regarding the condition and recovery.